Just relax for a moment. I'm going to remove your mask. Okay. How are you feeling? Good. Your throat's a little sore. That's normal. Here. I want you to take some very slow, careful sips, okay? Slow. Good. I'm glad that feels better. How are you feeling? Yeah, it's normal to feel a bit groggy for a while. Do you mind if I do a quick exam? Okay, thank you. I'll try to not disturb you too much, okay? So, I'm just gonna check your eyes. I'm gonna shine a light. You can just look up for me. I'm not going to do that too much. I know it's going to take a while for your eyes to adjust, so yeah, we'll spare you that. Okay. Let me listen to your heart. If you don't mind, I'm just going to sit beside you here. Okay. Take a deep breath for me. Here. Again. Okay. And again. Okay. Breath sounds are normal. Heart rate is a little bit slow, but I feel like that's to be expected. Okay, so you look like you're doing well enough to move over to recovery in just a few moments. We're just waiting on a bed. Of course. So, I would imagine you would like to get this IV off of your arm. Okay, give me just a moment. Okay. Move the saline out of the way. Now, I know that having tape removed on your skin can be a bit unpleasant, so I've come prepared with some baby oil that's actually going to help quite a bit. It helps sort of smooth the skin out and create sort of a lubricated surface. So, no, I'm sorry. You want some more water? Sure, of course. Here. Okay. Now I know the ventilation tubes can definitely be uncomfortable on your throat. I would recommend that when you're discharged and you're feeling better, go get a milkshake. Okay, so I'm just gonna wrap some baby oil on the IV site. That's gonna help get that bandage off. Okay, great. So, okay, we're gonna go very slow, I promise. Try not to hurt you. You're doing okay? Okay, good. Okay. So now I'm just going to remove the butterfly. Okay, good job. No, don't worry. Okay. Can you hold this cotton ball for me on your arm? Thank you. Yeah, put some pressure on there, please. Okay. Just gonna get some tape. Let's do one more. Good. Remove your finger. Thanks. Okay. Very good. So, just move some things out of the way, okay? Just a moment. about a little more water? Okay, so let's have you try and sit up just a little bit, okay? I'll help you. Very good. That feels better, doesn't it? A little more with it. Yeah. Okay. Here. Let's do some more small sips. Try to break up some of this ice for you. This water is really cold. Okay, here you go. Oh, slow. Better, thank you. Okay. Okay. So, let's go over some discharge paperwork, okay? Okay, let's see. Okay, so just a few questions. First of all, who's picking you up and taking you home? Okay. Okay. And what is the name and location of your preferred pharmacy? Okay. Okay, last question. Have you ever taken pain medications such as Vicodin or Percocet before? Okay, good. Okay, there's a good chance that the doctor is going to prescribe some for you, so if you've taken it before, you know what to expect, and the pharmacist will go over any expected side effects or things to be aware of. No driving, no operating heavy machinery, and not exceeding the recommended dosage. With the Tylenol added into the Vicodin or the Percocet, it can make you feel pretty nauseated. Yeah. Okay. Let's see. We established you don't have any known medication allergies. Okay, so before you're discharged from the hospital, they are going to give you a packet of information on how to properly take care of your surgical dressings. It's important to keep them dry and clean at all times. And a nursing assistant will go over with you how to shower and cover it up properly. But I just wanted to understate that, or underline that, it's very important to keep those areas clean and dry. We don't want to introduce any kind of bacterial or viral infection to the incision sites. Yeah, so that also means that for the first few days, possibly week or two, it's very important to take it easy. Okay? Yeah. So it's a good excuse to catch up on some Netflix. Yeah. Okay, let's see here. So, got through that checklist. Okay, so you're going to want to let the clinic know immediately if any redness occurs around the incision site, skin being warm to the touch, or clammy, any kind of change in from the normal. That's a bit on the extreme side. Also, any swelling, any bruising. Well, some bruising is normal, but if you see a large area around the sites, you want to let us know about that right away. And also fever, any night sweating, waking up and finding your bed sheets and pajamas are all wet with sweat. That's something we need to know right away. Okay? Yeah. Let's see. Otherwise, this says to check up with your primary care physician again in about 2 weeks for a follow-up, okay? Quick question. What is the name of your primary care doctor? Okay. Can you spell the last name? Okay. Do you know the phone number for his office? Okay. Okay. Got it. I didn't think, yeah. I thought we had that on file, but this is showing up blank with a question mark, so I guess we did not. So, that being said, oops. Okay, that is the end of the instructions that I have for you, which means that the nursing assistant who's going to move you down to recovery will go over the rest. So, I'm going to stick your chart up on the bed here. Okay, let me get you a little more water. Here, you know what? I will tuck this into the cup holder right above you. That way you have access. Okay. Okay, so it looks like you're doing great. You are ready to be discharged. So I'm going to let one of the nursing assistants know that you are ready to move down to recovery. Okay. Okay. Take care.